Hello, everyone. Hello. Ladies and gentlemen, welcome. Thank you. Welcome to this 15th CHAM convention, and the topic today is relevance and quality in healthcare. I actually asked my assistant ChatGPT to give me his take on the subject, and here is what it answered. Relevance in healthcare refers to the match between medical interventions and patients' actual needs. This means that healthcare must be based on sound scientific evidence and adapted to individual characteristics of each patient. Relevance in healthcare aims to avoid unnecessary, ineffective, or potentially dangerous care, while ensuring that patients receive the appropriate and beneficial treatment they need. Quality in healthcare refers to the extent to which healthcare meets established standards and expectations. This includes patient safety, treatment effectiveness, accessibility of services, care coordination, communication between healthcare professionals and patients, and patient satisfaction. Quality in healthcare is assessed using specific criteria and indicators such as complication rates, readmission rates, waiting times, etc. In 2023, how dare we pay for health services without assessing their relevance or results? The outpouring of uses and even dangerous prescription, as the non-quality of procedures performed are never questioned in the name of the sacrosanct obligation of means, which was understandable when medicine was powerless. However, today we must defend the obligation of statistically reliable results, as today's diagnoses are precise and today's therapies are effective. While no one can predict the outcome of treatment for a given patient or injured person, for 100 or 1,000 patients, averages and standards, deviations can be used to judge the quality of a given establishment, service or professional. The OECD estimates the percentage of unnecessary diagnostic prescriptions and treatments at 20%. Our healthcare system spends billions of euros a year uselessly every single year in France. And at the same time, next to the popular belief relayed by local elected representatives, proximity and quality do not go hand in hand. In oncology surgery, deaths and complication rates can double, triple, or even quadruple in more than 100 establishments with very low operating output that do not comply with the minimum threshold of 20 or 30 surgeries per year. The victims of this unbearable laxity are the elderly with limited mobility and the most disadvantaged who are uninformed. So we have to assess in order to restructure the offer of the hospital services. So this is the absolute priority, even if we have to travel miles in order to have a very good care. We actually have to look at the administrative services and all the agencies, administrative agencies, regional and central agencies that must be analyzed and analyze their efficiency and their management very regularly. From the industrial point of view, the regulation of access to healthcare products for patients need to be radically rethought, as a report commissioned by the French Prime Minister has just recommended. The construction of production plants and the marketing of drugs and the arrival to the market is too slow and delayed by endless and redundant procedures, but it should work much more faster within a more European framework, much more relevant by the organizations that are much better qualified. Very often regarded in France as a punishment mechanism, evaluation should instead be used to promote the improvement of services offered to patients. A cultural revolution in efficiency needs to be developed everywhere, using artificial intelligence and the billions of data it feeds to know in real time who is doing what, how, and at what cost. Without the help of an analysis of prevention processes and access to the right care by the right professional at the right time, with the right products and in the right establishment, we will continue to rack up an unsustainable financial deficit in the long term while seeing the quality of patient care deteriorate. There is not a minute to lose for all the public and private healthcare players, all those who are present here. So let's get down to work on real policy of evaluating our professional practices, as well as healthcare organizations and companies, the industry, as well as the regulatory bodies. And this is something our health system's future depends on. Thank you very much.